Hello, everyone. My name is Afusat Deng. It's an honor to present my scholarly project to you. The title of my project is The Impact of the Morse Full Scale and Purposeful Hourly Rounding in Fall Prevention. The project was part of the requirement for me to complete and graduate from the Doctor of Nursing Practice program at Maryville University. So in June 2022, the issue of increased fall was identified, and the problem was the focus of my project. So I got interested because the residents, especially at the memory care unit, were having so many falls, and there was no fall preventive interventions in place for preventing fall, even though the numbers of fall were being monitored by the Quality Improvement Committee. So I really got interested in that. So that's how I focused my project on fall prevention. And the aim of the project was to decrease fall by at least 50%. The theoretical framework that was considered for this project was the Lowen model of change, where we have the unfreezing state for when the desired of change is intended, the change phase itself when the project was implemented, and the rephrase phase where the outcome of the project was analyzed and it was assessed for sustainability. So there, I did some background information on fall prevention, and I found so many interesting information. I found that the falls can be categorized into three, which is accidental, anticipatory physiological falls, and unanticipatory physiological fall. I did found some studies that identified how the most fall skills was helpful and how purposeful hourly rounding was helpful in increasing in decreasing fall rate. Another interesting thing that I found out is that so several studies shows that falls could have been prevented in several ways. In a study that was done in 2022, but 2021 by Anno shows that for hourly rounding decreased fall by 36%. But another study shows that overall, all falls, about 92% of all falls, could have been preventable. And nurses were found to be very crucial because nurses are the frontline healthcare provider in taking care of the patient. So they were found to be crucial in preventing fall. And it was deemed necessary that nurses are engaged in proactive actions to prevent falls for the patient. So for me to determine which interventions will be appropriate for my patients, for the resident before I chose the topic, I did some research, article research, and I found that a screening tool is considered adequate if you require minimum training. It has predictive validity and it is easy to complete and has a high sustainability. All these qualities were found with the most false skill that is commonly used in several healthcare settings. We know that the most false skill can easily be administered. It can gauge the risk of a patient of falling, and it has six variables. The variables include the history of falls, the presence of secondary diagnosis, the use of ambulatory aid to be assessed. It will also assess if there is administration of intravenous therapy, the type of gait that the patient has will be assessed, and as well as the mental status of the patient will be assessed. And the score will determine the severity of the patient from falling. Also, I also did some research on the purposeful hourly rounding. I found that purposeful hourly rounding is very effective. The study that was done by Arnold shows that purposeful hourly rounding decreased fall by 36% in a long-term care. And also another study also shows that hourly rounding decreased fall by 21%, showing that hourly rounding is very, very efficient, and it will allow the nurses to actually physically go into the patient's room and proactively take care of all the needs of the patients. Here is a timeline for my project, which was about 21 months, starting from when the problem was identified up to when I analyzed and did the result phase. I also here is the flyers that I use to recruit the nurses. After talking to the leaders, here is the flyer I used to recruit the nurses. I also had the nurses complete a survey. I have the link and the QR code for them to use to complete the surveys to make sure that everybody working on the memory care unit can participate in the project. So this quality improvement project was a quantitative, quasi-experimental, retroactive chart review approach. Like I said, I identified several articles. I used the Maryville University Library resource. Initially, I found 130 databases, and I put phrases like fall prevention, most fall skill, purposeful hourly rounding, and it yielded 4,341 articles. And then I changed the parameters to be like full text, peer review, English language, publication within 5 years, academic journal. And when I did that, that actually reduced the numbers of articles that I got to 133. Then I also look at the article, make sure that it is relevant to the topic, and then it was just 25 articles that were deemed relevant to the topic. Then the 25 articles were grouped into three teams. So here is a slide on my inclusion and exclusion criteria. All the residents on the memory care unit where the project was included did met the inclusion criteria, which made my project quite easy to accomplish on that unit. So as you can see, like I said earlier, they did the unit before the project were monitoring the data, the four numbers of falls, and it was being monitored because it was part of the quality assurance performance improvement report tracking. So they were monitoring that even though there was no intervention to prevent fall. So that's how I got my pre-intervention data. And then the post-intervention data was actually during the projects. And that's how I got the data that I used for the project. So before I started the project, I had a 2 days competency training at different times to allow the nurses from different shifts to attend. The nurses were trained to complete purposeful hourly rounding every hour during the day and then every 2 hours at night. I also taught them, I provided the most for scale, the rounding log, and the data collection sheet that was used for the project. At the beginning of the shift, so during the project, at the beginning of the shift, the nurses will assess the patient with the most for scale, and then all throughout the shift, they will do hourly rounding and document on the rounding log, as you can see on the screen. The rounding log allow the nurses to meet the 5 P's for the patient. The 5 P's include pain management, body, patient positioning, proximity of possession, and also patient safety. So the nurses will assess that. The nurses will also documented on the rounding log the most for skills score, which is highlighted in yellow for the patient. So then all the data on the rounding log and the most for skill will be transferred to the data collection sheets. So here is the most for skill that was provided to the nurses. And here is the data collection sheet. So information from the most for scale and the rounding log were collated into the data collection sheet, and then that was how I was able to do my analysis. I transfer information from the data collection sheet into an Excel spreadsheet, which I use for the data collection sheet. If you can see that there are several informations that were included in the data collection sheet. And the information includes the numbers of residents on the unit, the numbers of falls that occur each day. They also ask if the preventive strategies, that is the most for scale purpose hourly rounding, was being completed. The gender was indicated as well. So I did the most for skill. I know it's an individualized assessment tool, because it allows to identify the likelihood of predicting falls. And as I said earlier, it has six variables. Each variable is scored, and the highest score is 125. The higher the number, the likelihood or the odds of falling for the patient. So the most false scale was found to be very valid and reliable. And then the data that I use, I maintain the quality, the inclusion criteria. I make sure that the nurses are there to their responsibility. I make sure that only information that was being recorded were used for the project. There was no manipulation of data. Several actions were taken to maintain ethical aspect of for the project. The actions that were taken includes getting an approval of the institutional review board at Maryville University. I also got an approval at the facility where the project was completed. Also, the rehabilitation center was also strict to making sure that the project was done fairly. The nurses and the residents' information were kept confidential, and there was no breach of the HIPAA law. And I will elaborate on the next slide. And there was no conflict of interest. I have no close relationship with any of the nurses or the residents. So there was no harm that occurred during the project, no harm foreseen or no harm that occurred, and no monetary gift was offered to anyone during the project. Here is a slide on how I protected the resident. The project did not breach the confidentiality of the nurses or the residents. I assigned a code to the nurses at the beginning of the project in the format CRC001, CRC002, CRC003, and so forth. The code was not included in the data collection sheet. It was only included in the most for scale, but not in the data collection sheet. So the nurses completed the random log and the full assessment to including the number of the patient residence room and the gender. So for instance, if a nurse document RM101P/M, that means to me that the patient is in room 101 in a personal. The P is for personal room, so it's not shared, and the M is for male patients. And if the nurse document RM122A/F, that means that the patient is in room 122 in a shared room, which is bed A, and the patient is female. Now, to maximize protection for the of the information, I make sure that the paper copy was scanned to digital copy. The paper copy was kept in a password protected safe, and it will be there for 5 years. While the digital copy that was scanned will be are kept in an Azure encrypted data storage in the cloud, and it will be there for 5 years as well. And the data collection sheet that I collected, and the most for skill and the purposeful hourly rounding law were kept in the password protected safe. So I did the analysis of my data, comparing the pre and the post for scale rates, and I completed the Z tests, and I had during the analysis the total number of sample before the project was the numbers of residents were 3,672 in total, with a number of fall of 42. And for the whole project, I had a significant zero point 0.5, I have effect of zero point 0.5, and a power of zero point 0.8. For the post fall, the numbers of residents were 3,674, which is relatively close to the pre fall, but the numbers of fall was 11. So, and that provided a proportion of 0.0114. So you can tell even from the data that there's a huge difference in the numbers of fall. And the confidence interval was 95%, which assisted in establishing the degree of variability. The confidence interval of the two proportions has a z value of negative 1.96, suggesting an actual ratio change from pre to post intervention. With the intervention, there is a significant evidence to show that a change in one direction, meaning that the exact change would occur from one group to the other if they were to repeat the project. There is likelihood of achieving the same results. The achieved power of the study was 0.9991, which is considered to be very high in strength, meaning that there is a high probability of finding a change if there is truly a change that is to occur. So the facility, you can see from the slide, the facility, the subacute rehabilitation facility where the project completed did have a positive outcome from this project. When we compare before the interval, there's as you can see on the slide, the slide shows that there was 26.8% of the residents had at least one fall, while during the project it was 16.1%, which is significantly different. So the project did show that the most of the falls occurred before the project. We found out that the fall rate differed by gender. So the female residents in the memory care unit tend to have more fall incidents than the male. I did not look into why that is, but that was just a finding. You can see on the slide the data and the graphic representation. So 79% of the fall incidents occur before the project, while 21% of the fall occur after the project. That's a significant difference, and which shows that the intended aim of decreasing fall by 50% was actually achieved. The fall was decreased by more than 50%, and you can see on the slide this information. So the fall interval were beneficial and had several clinical significance. The first significance was that the nurses were able to identify residents at risk of falling, which facilitated a good outcome for the patient because the safety of the patient were increased due to the attempt to prevent fall. Also, the project aided in improving the nurses' proficiency in assessing, in completing the most fall scale, in assessing the patients to identify their risk, and in enhancing close monitoring of the residents on the units. So overall, we know that this project was very, very beneficial because it did yielded a positive outcome in decreasing the fall. But despite all this benefit, there are some barriers and limitations that were encountered. Initially, the nurses were resistant to the change when I initially proposed it. They were resistant. How is this going to happen? How is this going to occur? But after talking to the leaders, after proposing my intentions, and after telling them that I will provide the most full skill, and I would train them, which I did, that really made them to be very willing to participate in the fall. So we did know that initially there was the knowledge gap among the nurses, but which got very, very improved. As I said earlier, the nurses were proficient in assessing the patients. And sometimes we do have incomplete or inaccurate documentation. Everybody, which was not the intention, but sometimes we do, but it was very rare. And then sometimes some nurses might call out due to emergencies or unexpected situations, or even because they were changed, the units were changed. So the manager had to start looking for someone to replace the nurses. So that resulted in decreased accountability. And sometimes we do have inconsistent nurses on the floor due to the use of agency nurses, contracted nurses. So that really did cause some struggles with the project because the nurses had to be aware that there's a project going on and they had to be impromptu, they had to be trained impromptu to for them to also be able to use the most full scale and assess the residents while on the memory care unit. Also, another struggle was that the rounding time sometimes cannot be predicted. Some patients require more care. So when a nurse goes into the patient's rest room, they might require more care, and that will affect when the next resident will be rounded on. And then another thing that was found, another limitation was the fact that there were limited scope of variability. So some factors could have been assessed, like where did the fall occur, when did the fall occur. Those are variability that was unable to be assessed. Overall, the project yielded a positive outcome, and also the nurses said that there were unintended consequences. So they had to, for residents that are really prone to falling, they had to have extra monitoring for them. They also said that the project made them to have additional documentation of the most full scale and the purposeful hourly rounding. So that was unintended consequences. So the good thing is that this project had a large sample size, and we did I did incorporated diverse demographics and different variability that were assessed during the project. Also because of the patients in the in the unit have diversity among them. So it really helped for me to look at so many factors while incorporating this project, and that made it very easy for this project to be generalized in a similar settings. So it is possible that this project can be also replicated in a similar settings. So the leadership of this facility in the subacute rehabilitation facility at the Eastern States, where the project was completed, after finding the positive outcome of the project, they were really, really impressed, and they did wanted this project to the interventions to continue. So they did wanted their nurses to continue to assess the patient, to continue to uh, round on the patient. So they started an open feedback loop to with the open feedback loop allow the nurses to actually provide their honest feedback about the project, about how it was for them to actually complete the responsibility, how it was everything was able to affect them, how the outcome was, how they feel about the outcome. So with the open feedback loop, the facility were able to identify where they need to improve, what they need to do to make the intervention more better, and they were intending to sustain the interventions that were used during the projects. So overall, the we know that increased fall has been established as a concerning issue in healthcare, and falls that are not addressed could lead to several consequences or injuries, and it can be fatal. So the focus should always be to to establish a safer and a healthier future for our residents by implementing changes that manage plans that are effective and well planned. Changes should include increasing awareness for fall factors and all the impacts that falls can have on the residents. So we know that falls, if it cannot be completely eliminated, but it can be prevented or decreased. Fall intervention is a top priority in healthcare. So for projects to be done in the future, the need for increased funding and support is necessary, and for project to look into for further insight into the cause of falls, how to foster a safe culture across all units for this project, because the project was completed in only one unit, by investing more resources. And the future project can look at why gender was a factor found. So overall, the most full scale and purposeful hourly rounding was very helpful in decreasing fall. Extend my gratitude to everyone that helped me, my professor, the facility, my professors, my chair, my family. Here are my references that I use. And once again, I thank everybody that made this project possible. And I'm so glad that this project will help to decrease falls for our residents and to help something that can be implemented in the future. Thank you so much for listening. And on the slide is my information if you need to contact me.